Which of the following measures is a normal specific gravity of urine? A. 1.000. B. 1.025. C. 1.050. D. 1.125. E. 1.275. Answer B. 1.025. Which of the following is a disposable glass or plastic tube used for hematocrit determination? A. Microcollection tube. B. Capillary tube. C. Reagent tube. D. Serum separator tube. E. Evacuated glass tube. Answer B. Capillary tube. Which route of temperature assessment is least invasive? A. Intranasal. B. Oral. C. Rectal. D. Temporal. E. Tympanic. Answer D. Temporal. The ratio for making a disinfectant from bleach and water is A. 1:5. B. 1:10. C. 1:20. D. 10:1. E. 1:100. Answer B. 1:10. To screen for hearing acuity or bone conduction of sound, the medical assistant would use an A. Otoscope. B. Ophthalmoscope. C. Tuning fork. D. Snellen test. E. Reflex hammer. Answer C. Tuning fork. Which of the following is not considered proper patient instruction for obtaining a clean catch midstream urine specimen? A. Have the patient remove undergarments. B. Make sure not to touch the inside of the container. C. Continue to hold the labia apart and void a small amount into the toilet. D. Clean the urinary meatus from back to front. E. The specimen container should not touch any part of the body. Answer D. Clean the urinary meatus from back to front. Upon discovering a known diabetic patient who is disoriented and confused, which of the following should the medical assistant do first? A. Check the vital signs. B. Give a form of glucose to the patient. C. Draw a blood glucose. D. Check for spontaneous respirations. E. Ask what symptoms the patient is having. Answer B. Give a form of glucose to the patient. A procedure that a medical assistant would not expect to take part in when doing minor surgeries in the office is A. Suture of lacerations. B. Biopsy of the lung. C. Cyst removal. D. Biopsy of a skin lesion. E. Incision and drainage of a wound. Answer B. Biopsy of the lung. Heart sounds that are heard when the blood pressure is being measured are called the A. Korotkoff sounds. B. Rinne sounds. C. Snellen sounds. D. Ishihara sounds. E. Jaeger sounds. Answer A. Korotkoff sounds. The popliteal pulse is located A. On the thumb side of the wrist. B. Behind the knee. C. On the dorsal surface of the foot. D. At the apex of the heart. E. At the inner aspect of the leg and the groin. Answer B. Behind the knee. The most important thing to do to prevent transfer of infectious material is A. Use biohazard bags. B. Dispose of sharps in a rigid container. C. Wash your hands. D. Disinfect patient care equipment between uses. E. Wear gloves when exposed to body fluids. Answer C. Wash your hands. Which of the following types of urine specimen contains the greatest concentration of dissolved substances? A. Random. B. First voided morning. C. Clean catch midstream. D. 24-hour. E. Second voided. Answer B. First voided morning. When moving a heavy object, one should A. Bend from the waist to lift the object. B. Ask for help if an attempt to lift the object shows that it is too heavy. C. Make sure that the object is at least 5 inches away from the body. D. Assess the object prior to trying to lift it and ask for help if needed. E. Lift heavy objects only if they are stored at waist level or higher. Answer: D. Assess the object prior to trying to lift it and ask for help if needed. When removing paper that is soiled with biohazardous waste from the exam table, the medical assistant should do which of the following before cleaning the table with disinfectant and pulling down unused paper? A. Use sterile gloves. B. Roll the paper inward and toward the body working from the end of the exam table. C. Gather the soiled paper in gloved hands and discard. D. Using unsterile gloves, roll the paper down toward the body and discard. E. Roll the paper inward and away from the body, discard, and change gloves. Answer: E. Roll the paper inward and away from the body, discard, and change gloves. In an infant, you should check the pulse in which of the following arteries in an emergency situation? A. Carotid. B. Radial. C. Brachial. D. Femoral. E. Temporal. Answer: C. Brachial. The generic name for Lipitor is A. Atenolol. B. Atorvastatin calcium. C. Clopidogrel bisulfate. D. Furosemide. E. Amlodipine. Answer: B. Atorvastatin calcium. After a patient has had a grand mal seizure, one would expect the patient to be A. Confused and drowsy. B. Excited and hyperactive. C. Hypotensive with a decreased pulse. D. In need of airway management. E. Needing immediate transport to the hospital. Answer: A. Confused and drowsy. The most appropriate position for a patient with respiratory problems is A. Trendelenburg. B. Fowler's. C. Lithotomy. D. Dorsal recumbent. E. Prone. Answer: B. Fowler's. Which of the following is not a normal vein for phlebotomy? A. Cubital vein. B. Brachial vein. C. Hepatic vein. D. Cephalic vein. E. Basilic vein. Answer: C. Hepatic vein. Which of the following situations would be of least concern when involved in a sterile procedure? A. Talking over the sterile field. B. Loose, uncovered hair on a member of the sterile team. C. A non-sterile person entering the room. D. Adding non-sterile items to the sterile field. E. A tear in the glove of a member of the sterile team. Answer: C. A non-sterile person entering the room. Draping is done primarily for A. Convenience of the doctor. B. Keeping the patient warm. C. Patient privacy. D. Convenience of the medical assistant. E. Facilitating the specific exam. Answer: C. Patient privacy. To take the blood pressure correctly, the medical assistant should A. Use any blood pressure cuff that is available as long as it fits the patient's arm. B. Have the arm at or near the level of the heart. C. Pump up the cuff until the pulse is no longer audible. D. Release the air from the cuff rapidly in order to decrease patient discomfort. E. Position the cuff so that the artery marker is at the level of the elbow. Answer: B. Have the arm at or near the level of the heart. A person who has difficulty breathing and experiences swelling of the respiratory tract following a bee sting may have A. A myocardial infarction. B. Anaphylactic shock. C. Obstructive airway disease. D. Cardiogenic shock. E. An asthma attack. Answer: B. Anaphylactic shock. Which of the following is not a true statement regarding tuberculin testing? A. A small amount of tubercle bacillus is administered intradermally. B. The results are read in 48 to 72 hours. C. Induration is a positive indicator of disease. D. A person who has been vaccinated with BCG will test positive. E. Follow-up testing for a positive test includes chest X-ray. Answer, C. Induration is a positive indicator of disease. Which one of the following is not a proper procedure for performing the Multistix 10 reagent strip test? A. Immediately recap the testing strip bottle. B. Do not touch the strip with your fingers. C. Hold the strip in a vertical position. D. Completely immerse the strip in the specimen. E. Discolored strips should be discarded. Answer, C. Hold the strip in a vertical position. Which type of thermometer should not be used in the medical office? A. Digital. B. Disposable. C. Glass. D. Infrared. E. Tympanic. Answer, C. Glass. Which of the following instruments would not be needed when preparing for a cyst removal? A. Scalpel. B. Needle holder. C. Sen retractor. D. Dressing forceps. E. Speculum. Answer, E. Speculum. To encourage an elderly patient to give information while taking the patient history, the medical assistant should A. Ask questions that can be answered with yes or no answers. B. Interview a family member instead of the patient. C. Speak loudly because the patient is likely to be hard of hearing. D. Inform the patient in the beginning that there is only a short time to perform this history. E. Ask open-ended questions. Answer, E. Ask open-ended questions. Urine or serum pregnancy tests are utilized to detect the presence of which of the following? A. Antidiuretic hormone, ADH. B. Human growth hormone, HGH. C. Heterophile antibody. D. Human chorionic gonadotropin hormone, HCG. E. Phenylketonuria. Answer, D. Human chorionic gonadotropin hormone, HCG. The correct position to place a patient who has fainted is A. Prone. B. Trendelenburg. C. Lithotomy. D. Supine. E. Fowler's. Answer, D. Supine. If a medical assistant is giving a 75-pound child a dose of antibiotic using Clark's law, which of the following would be administered if the usual adult dose is 500 milligrams? A. 500 milligrams. B. 250 milligrams. C. 200 milligrams. D. 125 milligrams. E. 375 milligrams. Answer, B. 250 milligrams. When performing an EKG on a patient, if the tracing is not what is expected, the first thing that should be checked is A. Placement of the electrodes. B. The status of the patient. C. Electrical interference. D. Machine settings. E. Patient movement. Answer, B. The status of the patient. When performing a surgical hand scrub, make sure to A. Wash for 60 seconds. B. Hold fingers lower than the wrists. C. Dry hands with paper toweling. D. Hold fingers higher than the elbows. E. Dry hands before turning off the water faucet. Answer, D. Hold fingers higher than the elbows. Lyme disease, if untreated, can progress into A/N. A. Viral infection. B. Contagious disease. C. Chronic infection. D. Acute infection. E. Non-pathogenic condition. Answer, C. Chronic infection. Initial treatment for a sprained ankle would include A. Application of a heating pad in 20-minute intervals for the first 48 hours. B. Exercise the ankle in order to prevent stiffness. C. Application of ice in 20-minute intervals for the first 48 hours. D. Massage the ankle with pain relief ointment as needed. E. Application of an air cast to the lower extremity. Answer, C. Application of ice in 20-minute intervals for the first 48 hours. Which of the following reagent strip panels would show an abnormal finding if a person is suffering from a bacterial urinary tract infection? A. Plus, glucose. B plus nitrites. C plus ketones. D plus bilirubin. E plus protein. Answer B plus nitrites. To palpate the pulse in an adult, the usual procedure would be to A. Listen with a stethoscope at the apex of the heart. B. Feel at the inner aspect of the thumb side of the wrist with the first two fingers. C. Use the thumb of the dominant hand to feel the temple area of the skull. D. Located between the larynx and the sternocleidomastoid muscle in the side of the neck. E. Press deeply below the inguinal ligament in the groin. Answer B. Feel at the inner aspect of the thumb side of the wrist with the first two fingers. To have a method of checking to see if an autoclaved item is sterile, the medical assistant should A. Place indicator strips in the packs and envelopes and use autoclave tape to secure the packs. B. Set the timer on the autoclave to run for 30 minutes to ensure that the items are sterilized. C. Open one pack and check the indicator strip for sterilization after each autoclave batch is run. D. Leave an open flap in the packs to view the indicator strip to ensure that it is sterile. E. Open the autoclave prior to the drying cycle to view the indicators and tape and confirm that the item is sterile. Answer A. Place indicator strips in the packs and envelopes and use autoclave tape to secure the packs. In which of the following radiographic positions is the patient lying on their back? A. Prone. B. Supine. C. Oblique. D. Lateral. E. Postanterior. Answer B. Supine. Which of the following values is considered a desirable cholesterol level? A. 0 mg per dl. B. 180 mg per dl. C. 230 mg per dl. D. 250 mg per dl. E. 300 mg per dl. Answer B. 180 mg per dl. Using sterile instruments to perform a breast biopsy is an example of A. Surgical asepsis. B. Sterilization. C. Medical asepsis. D. Personal protective equipment. E. Sanitization. Answer A. Surgical asepsis. Wearing a mask, gown, and gloves when working with a patient is an example of using A. Barrier method. B. Standard procedure. C. Personal protective equipment. D. Body substance isolation. E. Surgical asepsis. Answer C. Personal protective equipment. Applying an elastic or ACE wrap to a sprained ankle is an example of A. Bandaging. B. Applying a dressing. C. Splinting. D. Casting. E. Treating a wound. Answer A. Bandaging. Which one of the following is the correct angle for a needle to enter the vein for venipuncture? A. 5 degrees. B. 15 degrees. C. 30 degrees. D. 45 degrees. E. 90 degrees. Answer B. 15 degrees. Which of the following is a gram-positive cocci that grows in clusters? A. Staphylococcus aureus. B. Neisseria meningitidis. C. Mycobacterium tuberculosis. D. Escherichia coli. E. Streptococcus pneumoniae. Answer A. Staphylococcus aureus. A scraping of the superficial layer of skin is called aslashon. A. Abrasion. B. Avulsion. C. Laceration. D. Incision. E. Contusion. Answer A. Abrasion. When preparing the skin for a minor surgical procedure, the medical assistant should A. Wash the skin with antiseptic soap in an up and down motion and using friction. B. Wash the skin with antiseptic soap from the inner area to the outer in a circular motion. C. Wash the skin with alcohol and air dry. D. Wash the skin with antiseptic soap after applying sterile gloves and gown. E. Wash the skin with a disinfectant solution from the inner area to the outer in a circular motion. Answer, B. Wash the skin with antiseptic soap from the inner area to the outer in a circular motion. Which one of the following diseases is confirmed by a positive VDR-RPR? A. Hepatitis. B. Mononucleosis. C. Syphilis. D. Rheumatoid arthritis. E. Systemic lupus erythematosus. Answer, C. Syphilis. If the medical assistant notices a small tear in the sterile glove during a procedure, they should A. Put a piece of sterile tape over the hole in the glove. B. Alert the physician that they are not able to assist any longer. C. Ask a coworker to put on sterile gloves and take over. D. Continue the procedure but do not pick up sterile objects with that hand. E. Step away from the procedure and replace the gloves with new ones. Answer, E. Step away from the procedure and replace the gloves with new ones. Which of the following statements is true? A. A spirometer is used to measure the relative humidity of exhaled air. B. The specific gravity of urine is part of the microscopic examination of urine. C. The erythrocyte sedimentation rate is a means of identifying how fast blood clots. D. Hematocrit is expressed in mm/section. E. Hemoglobin measures the oxygen-carrying capacity of blood and is expressed in G/dl. Answer, E. Hemoglobin measures the oxygen-carrying capacity of blood and is expressed in G/dl.